before we get started, we always love to thank our sponsors as well, those that really support our education series. We do 36 of these a year. In addition, we have 48 cooking webinars that Erin and her team lead that are dynamic. If you have not gotten on there, please do. They are just pure joy, a lot of fun. And I always wished I lived in Philadelphia so I could take Erin's leftovers, but I do not. So what I wanted to do is just to share my screen and just share that we are very grateful for our education sponsors. Our presenting sponsor you'll see is Wes and Merck. And then we also have Daiichi Sankyo, as well as our supporting sponsors, GSK and Lilly. So we can't do what we do without them. And they continue to lift us up. They love our program because they know that we can help patients adhere to treatments. And that is key for all of the integrative care space. So thank you so much to those sponsors.
Absolutely. And as we move through the segment, we do ask that you keep yourself muted, but please feel free to add any questions or comments in the chat. Both Sue and I will be perusing the chat and sharing them with Dr. Rao. Of course, we'll have time for questions at the end as well. I'm sure there will be very active questions at the end. So know that, as usual, we'll have time for that once we move through the presentation. And I'll share a little bit of a reminder. So we've had a lot going on in March in terms of our education segments. It is National Nutrition Month. And so our culinary dietitian team will be wrapping up our month of segments with our Ask the Experts next Thursday, March 28th. It will be streaming live on our Facebook page. So we are calling this our Nutrition Rapid Fire segment. So our 4 dietitians, so myself, Michelle, Aubrey, and Catherine, will be answering as many nutrition questions as we can get through. So feel free to submit your own nutrition questions, and we'll be tackling as much as we can. So we're calling that our little rapid fire. And again, that will also be recorded. So if you can't make it 1 p.m. Eastern time, you can always pop back in and watch the segment afterwards.
Yeah, Erin, that's going to be a long segment. You will not get away with 30 minutes. It's too many questions. It always happens. I love it.
know.
Yeah.
I know. We're excited. I can tell our whole team is really excited.
Wonderful.
All right.
I think we can get started. What do you think? Got a reminder?
Absolutely.
Yeah.
Great. Yep.
Okay.
All right.
So if we want to bring front and center our guest for this evening, we are so honored to have Dr. Rao here. He is the Medical Director of Integrative Oncology for the University Hospitals Conard Whole Health, which is a part of the integrative medicine team. He is board certified medical oncologist as well as an integrative medicine provider. Previously, he served as the Medical Director of Integrative Medicine at Banner MD Anderson Cancer Center, because Dr. Rao has an incredible shining light behind him. That is why his blinds down. So previously, he was the Medical Director of Integrative Medicine at Banner MD Anderson Cancer Center in Arizona, as well as the Director of Supportive Oncology since 2021, where he led a distinguished program including massage, acupuncture, yoga, meditation, diet, and lifestyle direction, and integrative oncology. All sounds very familiar, right? Please join me as we welcome our guest tonight, Dr. Rao. Thank you.
Thank you so much, Sue and Erin. Let me share my screen. And thank you all for showing up. I'm really excited to talk with you. I know that many of you already know a lot about integrative oncology, it sounds like. And so, hopefully we'll have time to chat afterwards and get more kind of deep into some of the questions. So I'm going to talk about integrative oncology and personalized cancer care. I am the Director of Integrative Oncology at University Hospitals in Cleveland. I'm also a medical oncologist. So that gives me kind of a somewhat unique perspective, because I often, will be able to really better kind of translate what some of the oncology team is asking a patient to do, and there's some deep conversations that happen. I'm also the president of the Society for Integrative Oncology. So, everyone has their own story. I'm going to talk about a woman that I saw who is 43 years old. she had what we call triple negative breast cancer. So it was negative for estrogen, progesterone, and HER2, negative genetics. And she had 2 young children. She mentioned to me that she had postpartum anxiety and depression. And just speaking with her, she used to be a runner. And then she got diagnosed. She ended up getting treated with chemotherapy and immunotherapy, followed by surgery and radiation. And after that, she had complications from her treatment, which included neuropathy, fatigue. She had hot flashes. She had pain in her breast from radiation, bloating, difficulty sleeping with racing thoughts, joint pains, nausea from chemo, which persisted, fatigue. And she came in asking us about the benefits of acupuncture, Chinese herbs, stress management, and nutrition. So this is a very kind of common consult that I get. And, in the field of cancer care, we're so used to characterizing the cancer without necessarily connecting with the person. Now, I can say that, all of my colleagues in the field of cancer try very hard not to do that, okay? But the way we characterize how we're going to treat someone is often by their stage. It's very algorithmic. What kind of cancer? What are the particulars? And all of that tends to sometimes depersonalize the whole process. But the reality is we need to ask people what their preferences are, and we need to work with them. We need to identify what their background is. What kind of questions do they have? We know that a lot of people, as soon as they get diagnosed, they may talk to people, they may look on the internet and have a lot of questions. And I think this is a really important one. How do we help people feel empowered and really an active part of their healthcare plan? Getting diagnosed, a lot of that power, often is taken away from you when somebody comes in, first of all, telling you what you have. There's a lot of anxiety and fear around that, but generally, we don't always give people a lot of choice. We say, this is the treatment, And then finally, how can we better support individuals going through all this? So that brings us to integrative oncology. So this is the definition of integrative oncology. Basically, I'll highlight the important parts for me. First of all, it's patient-centered, evidence-informed. So we do lean on evidence as much as possible. And it utilizes different traditions alongside conventional cancer treatment. So it's complementary, certainly not alternative. And in addition, the focus is on empowering people to become active participants anywhere in their cancer journey. So that's really, really important. And you can see on the right, this is a diagram showing that it often, encompasses lifestyle, mind, body, and the use of natural products. So if we break that down a little bit more, this is the way I think of it, that, part of it is looking at lifestyle, and that may be education or programs focusing on diet and exercise, stress management and mind-body approaches, symptom management, and I'll talk more about that. And then how can we help guide people with the use of complementary therapies and natural products, focusing on safety? How do you coordinate that with whatever your team is recommending? And then personalizing a plan. So during an integrative consult, it's really about an hour is what I spend. And we focus on all these different areas: diet, physical activity, stress, sleep, spirituality, what kind of complementary therapies or natural products somebody's using. You personalize the approach and you utilize whatever services are available as well as in the community, and coordinate a complementary approach. And this is one kind of model of integrative care, just looking at how the typical management of physical and social needs to be expanded. And there's a lot of different things that we can focus on with psychospiritual, et cetera, to really have a more holistic approach to a patient care. So I'm going to focus first on the lifestyle component. And you have to take a step back when you think about prevention, and that also includes prevention of recurrence. You have to think, what causes cancer in the first place? Now, I'll say that many people, there are times where somebody comes in and you have a very good sense of why they got cancer. They smoked for 50 years or, something like that. In those situations, the question doesn't come up, okay? But there are many times where it's not a genetic thing. There's a lot of young people who get diagnosed, for example, and none of us know why, right? And often we try to think of it in terms of like there's one thing. Usually it's not just one thing. It's a combination of factors, many of which we don't really understand. And we think of it as a progression from pre-cancer all the way up to cancer. And we're still learning more and more about, how early in life this process really starts. So, that makes it challenging when somebody's actually diagnosed, because it's really common for people to say, well, I'm going to fix this, this, and this. But that process may have started when they were young, and they were not, conscious of anything that they might have been doing, or they might not have done anything, wrong in the first place, right? So, you think of it in terms of the individual factors, which we call host factors. There's dietary lifestyle factors, and then there's environmental factors, many of which we still don't completely understand, and that all needs to just be kind of said. We know that there are, cancers that tend to occur more often with, preventable causes. Smoking is still number one, and you can look at, excess body weight, physical inactivity, and the others. I will say that in different countries, this looks a little bit different, based on the socioeconomic conditions. But generally speaking, there's a lot of opportunity to reduce cancer. People have said that in the US, for example, a majority of cancer is related to lifestyle factors. And part of that is obesity. So we know that obesity is on the rise. You can look up at the top and on the left, and that was 1990, and that's just BMI over 30, so being obese. And if you look on the bottom right, the projection is that in 2030, it looks like almost the same, and that's severe obesity. So, it's just getting worse, and it's a problem. These are the different risk factors on the left, genetics, socioeconomic status. Some of these things are a little bit complicated, like, the socioeconomic status, it actually is middle income. If you're poor, then there's actually a lower risk of being obese. Dietary patterns like fast food, inactivity, insufficient sleep, which, many times we don't think about. Microbiome, which is a fascinating area. And there's a lot of research going on in that area. In animals, for example, they can do a transplant and make an obese mouse thin. So who knows what this is going to look like in the future. Stress, has a component. And then there's environmental causes. There's something called metabolism disrupting chemicals, which is actually microplastics. And I don't think about it, but apparently this is one of the causes of obesity, and not something you can work off, In breast cancer, so breast cancer is a hormonal cancer in general. These are some of the ways that obesity contributes. First of all, it's endocrine, it's kind of a hormonally active cell, the fat cell. So it increases insulin, it produces estrogen, which is more important in postmenopausal women. And then it can increase inflammation as well. And all of this has an effect on the cancer as well as the environment that the cancer lives in. So there's signaling pathways, there's metabolic effects such as insulin, et cetera, that increase growth. And then there's inflammatory effects on the tumor microenvironment. A lot of research in this area, but generally the outcomes are worse, and you have more risk with treatment as well. We know that because our US population is aging and getting more obese, and the treatment is improving, we have more cancer patients, and they're actually living with their cancer more and more, or living post-cancer. And so the result of all that is that we have more and more cancer survivors, which is good in one way, but many of these folks have symptoms they have to live with, obviously recurrence risk and fear of recurrence. And then there's other, comorbidities and others, diseases that people have once they've been diagnosed. There's a higher risk of heart disease. And so, there's an ongoing kind of concern. So, there's a great need to not only prevent a recurrence of cancer, but to deal with the symptoms from cancer and its treatment. So exercise is super important. This was one study showing that after a diagnosis of colon cancer, if you increased your exercise you had a half the risk of dying. But if you decreased your exercise after diagnosis, you increased your risk. I mean, you can just see how startling those curves are. This was a breast cancer study that's famous called the whale study. And basically, if you were in this arm where they gave you a low amount of fruits and vegetables and you didn't exercise much, that's the gray curve. And the blue curve is if you had lots of fruits and vegetables and you exercised a lot. And this is survival. I mean, it's just crazy if you look at the difference between that. And furthermore, in the obese population, which is the yellow curve, the difference between the high fruits and vegetables and high physical activities on the right, and it basically, eliminated the gap of the difference in survival between somebody who was obese and non-obese. But if you were in this low activity and low fruits and vegetables, you see the difference there. This is fascinating. So the American Institute of Cancer Research has put out these 10 goals for cancer prevention, which you're supposed to try to follow even if you've been diagnosed. Now, I will say that not all of this is 100% scientific. It's enough that this is, a strong statement, but there's a lot of caveats, I would say. So I'll go through these. One is obviously be a healthy weight. I think that's, pretty well established. Being physically active, and I'll go through the guidelines for that. Limit consumption of sugar-sweetened drinks. That's becoming more and more clear how bad that is. Alcohol is getting a bad name. We used to talk about it, well, it's bad for Alzheimer's, it's bad for your liver, but it's probably good for your heart. I don't think it is. So right now it's kind of like a bad thing, although socially I can completely understand. Fast food, diet is supposed to be high in fiber generally. And then this other one, limit consumption of red and processed meat. I feel like many people argue about this, even in the field of integrative oncology. I think part of it depends on what you're eating. If you're hunting versus barbecuing, I think that's a big difference. Processed meat is not good for you. Red meat has gotten kind of a bad name because of iron, and there's just very little research on this. There are studies looking at this post-diagnosis, and it's not clear if it makes a difference. So, I really tread lightly. I think there are other people who, there are studies out there looking at vegan or vegetarian, and some people have gone completely, into that, kind of mindset that, they're going to tell somebody. I feel like, I really pick and choose. And for some people, they have a very good prognosis. I think about their overall health, but I'm not going to be really, really strongly opinionated on this yet. I feel like we need to do more research. But there are other people that eat meat twice a day. And so I'll be like, you might want to think about it. So that's about as strongly as I put it. Obviously for mothers, breastfeed your baby if you can. And then don't use supplements for cancer prevention. And this is another one that's a little bit opinion-based, but there are some studies. The goal is to get as much through diet as you can. And there's a study in Sweden looking at cancer prevention if you adhered to all of this, especially the dietary and lifestyle recommendations. And it did improve or reduce cancer incidence if you adhered to the lifestyle scores. So that was fascinating as well. So this is the recommendations for physical activity and nutrition. Generally, you're supposed to get 30 minutes a day for 5 days a week, or 75 minutes of vigorous activity. I don't really tell people to get the 75 minutes. I'm more of a believer in, consistency. And then it's modified if you're on cancer treatment. And then, the idea is to mix it up. So a couple sessions of strength with some flexibility, some cardio generally. And then the diet, I mentioned whole grains, a lot of fiber, limit alcohol, and reduce sugar. So, this lifestyle program I want to highlight. There's no perfect time to screen someone, but generally I don't focus as much on, prevention when somebody's going through chemo or getting surgery or radiation. It's usually after that. And there's this online program which is free. It's called the Anti-Cancer Lifestyle Program. There's some amazing people who've contributed. And it basically gives you 12 hours of free videos that are very high level. and we'll give you a general overview of what you need to know about diet, exercise, body exercise or mindfulness, how to make change in your life, and then environmental health. So check it out. I'm a big fan of that. So I'm going to switch now to stress management and mind-body approaches. So we know that stress, and really it's chronic stress, and the way we think about stress, which is your reaction, all of us have stressors, but the reaction of that fight or flight response. And that can cause hormonal changes, increases in cortisol and insulin. It can suppress your immune system. All of this is bad from a cancer standpoint. It can reduce your telomere length. Telomeres are at the end of your genes and contribute to instability in your genes and aging. So there's all sorts of things. It can lead to bad behaviors. What if you start smoking again because you're stressed out, etc. Mood changes. And there's actually changes that happen in the cancer and the environment the cancer lives in, as well as your body. So not good for you. So we have strategies to try to combat stress. So these are some of the things that I listed. Exercise is super important, and that may be any type of exercise, but there are some exercises that unite the mind and body perhaps more, like yoga, tai chi, etc. But that can be personal preference. Expressing yourself, if that's something that you enjoy. There are integrative modalities like massage, aromatherapy, sometimes the use of natural products, sex, which is something we don't talk a lot about, but obviously, relationship is important. Sleep is super important. Meditation, which includes mindfulness and breathing exercises, prayer, and then various other modalities. I think gratitude is really important. Trying to get yourself in that mindset rather than thinking about the pain, that has been shown to be very helpful. And for some people, they may need counseling or psycho-oncology. And so, the Society for Integrative Oncology and American Society of Clinical Oncology have come together for some guidelines. So I'm going to highlight a few of them. This was last year, looking at anxiety and depression. And really, these are the things that are most evidence-based. And you can see that for both anxiety and depression, mindfulness interventions were high on the list. Yoga, there was some mention of relaxation therapy, and then post-treatment, acupuncture for anxiety, etc. Lavender got a mention in active treatment. But, pretty much you could see that music, they're all pretty much the same. So we have some options there. And one of the things we really want to think about is what is the right thing for which patient. And there's a lot of work that we need to do because you have these options, but you don't know, first of all, you have to ask somebody what they like. And then secondly, there are situations where one may be preferred over another. So for example, for insomnia, cognitive behavioral therapy is more effective. But there was this study showing that in people who had pain, and that's why they weren't sleeping, acupuncture was more effective. So you have to think about, what are all the symptoms somebody has? And especially in people who really believe in acupuncture, it was even more effective. So there's a discussion to be had. So that gets us to symptom management. And we really try to look at guidelines. So this was from the National Coalition of Cancer Survivorship Survey, 2023, looking at what kind of symptoms people really have as survivors. And you see that fatigue is very well represented. There's mood disorders, pain, joint pains, etc. Okay. And so, what we follow a lot in oncology is something called the National Comprehensive Cancer Network Clinical Practice Guidelines. We call it NCCN guidelines. We use this all the time. And integrative approaches are more and more represented in the NCCN guidelines. And so this is just a really nice chart looking at all the mentions of integrative approaches for these different symptoms on the left. And so this is super helpful. And, while this doesn't mean that it's 100% scientific, it's well accepted. This was another ASCO-SIO guideline on pain. And again, it's just, to me, more about where the evidence is. I think it's still growing, but you can see that, for joint pains, we have the options of acupuncture and yoga. cancer pain, all these different things. And so, hopefully in a few years, we're going to get more and more insurance coverage as the evidence improves, because we have these, ASCO is really the main cancer organization in America. And if they've co-signed these kind of guidelines, it should eventually lead to insurance reimbursement, which is my hope. This was a study that looked at acupuncture and massage for cancer-related pain, and it showed that both of them worked really well. So these things are really helpful also, as we start thinking about what's the right thing for which patient. And then finally, we guide people in the use of complementary therapies and natural products. So looking at that, first of all, we know that integrative approaches are getting more commonly offered. So this is a little bit hard to look at, but basically between 2009 and 2016, there's a huge expansion. And this has not been updated since then, but you would expect that now it's most cancer centers. This is, basically NCI, which are the largest cancer centers. Most are now offering some integrative therapies, including acupuncture, massage, nutrition, meditation, very common. The issue is that, first of all, we know that patients are using complementary medicine, but they don't always use it in a way that is looking at the evidence. Okay, so it's just, I read this, I talked to someone. And what can happen is that care can get fragmented. Either somebody is seeing somebody outside of our cancer center and not telling us, or just doing it on their own. And many of the providers, the oncologists, the surgeons, etc., don't feel like they know enough to answer the questions. And it's a major business, often not well regulated, and it's becoming really popular. So, the idea is that we want the care to be evidence-based, scientific. We want it to be coordinated. I want to know what my patient's doing and have some, coordinated strategy. And we want it to be personalized. We want people to feel empowered. Okay. In the same NCCS survey, these were the different integrative modalities that survivors use. So you can see prayer and spiritual practices are the most common, but supplements are there, massage, acupuncture, etc. And these are the reasons that people use them. They used the integrative therapies for well-being, control over my illness, giving me hope, managing symptoms was very common. Why would some people not use them? They weren't aware that these existed, so that's still obviously a major problem. It's not covered, it's too expensive, so that's another huge issue. So we know that there's issues with equity. And I'm sensitive to this because as the evidence is growing, we're really showing that these things make a difference. I think it started out maybe 15, 20 years ago where, not everybody believed in integrative approaches. And then a lot of this has been moved forward by patients who are asking for these types of therapies. And they're being offered, but we don't necessarily have all the evidence to say how much of a difference they make. Now it's kind of the conversation's changing. We're getting more and more evidence of how effective and important some of these therapies are, to the point where they're in guidelines. And that can really impact somebody. What if you can reduce somebody's narcotics? What if you can keep somebody on their chemotherapy? What if somebody can go back to work? All these things are really important outcomes, but the model isn't there yet for us to really have a system to make it affordable for all. And so what ends up happening, depending on where you live, it may or may not be available, and it may be really expensive. And so that creates a gap where some people can't afford it. And so I'm sensitive to that because often the people who need the help are not getting it. So, how do we get this insurance covered? How do we get a system in place that that supports the use of these therapies? And I'm going to finish up talking about natural products. This was on the right side is a study looking at vitamin D and showing that it didn't really prevent cancer overall. We talk a lot about that, but it did reduce mortality once you got diagnosed. So there's just questions about these things. There's a lot of variability in the studies. We don't know how much it really helps. Certainly, I do recommend vitamin D, and there's some that are harmful. There's a study looking at vitamin B12 and iron, and those seem to be associated with worse cancer outcomes if you take them. Obviously, some people need to be on iron, some people need to be on B12, but those are, potentially important, facts. And then there was a study in JAMA looking at people who, went away from conventional therapy and used complementary medicine, and they obviously did worse. So, I think pretty common sense. So how do we approach the use of natural products? First of all, there's limited evidence. These are some of the best resources. So Sloan Kettering has a website called About Herbs that's really very informative if you want to look something up. Then there's the Natural Medicine Comprehensive Database. We use that a lot to look up interactions. And one that I've been using recently is called EfficaSafe from Israel. I think experience is helpful. I've seen this in my own practice where we start using a supplement like ashwagandha, and suddenly all my breast oncology colleagues are using it. And it's just because it works, it's for certain situations. So even though we may not have completely characterized it from a scientific standpoint, people get used to kind of what seems to be helping. So I do feel like clinical experience is helpful in talking to people who are experienced. And you really have to balance the risk benefit and focus on safety primarily, but also prioritize where the evidence exists. And we really look a lot on quality and source, because that's been a problem with natural products. So this was one algorithm that was put out looking at, looking up the evidence and seeing what the risk level is of the supplement and patient preference. And, it's a little complicated, right? Thinking about this in the individual patient. And really, for me, it's about picking your battles. I want people to have some say if they're interested in taking something. What's their personal goals? What are their beliefs? What is their risk tolerance? What's my risk tolerance? So I'm very conservative during chemotherapy. But if somebody's got very advanced disease, maybe me and the patient have more risk tolerance. These are kind of conversations you need to have. There's also an assumption of whether something will help. Many times people say, I heard that this is going to be, great for my cancer. There may not be evidence of that. But we also sometimes have an assumption that there's no benefit. None of these things help at all. And that's not necessarily true either. And in an ideal world, we'd be systematic about it. And I'm trying to work on that. And so are a lot of other people. So there's a lot of work to be done. The good news is that research is growing in integrative medicine. I mean, this is just the amount of papers that have been put out, and you see that it's growing. So that will help. And where does that lead us to? So this was one study looking at the microbiome and patients who get immunotherapy. And it just turned out that this was in mice, that they had a better response to immunotherapy if their microbiome was diverse. And this is not something that we thought of before. Why would that be the case? But we need to be aware of these interactions, because that could potentially affect, in this case, whether you take probiotics, which was harmful for the patients on immunotherapy. There's some research looking at cannabis, that might not be a good thing if you're on immunotherapy either. On the flip side, being on a high fiber diet is thought to be helpful, and based on some studies. And so, if you can make these changes and influence your treatment outcome, that's the kind of information we need to have. So these are some of the resources that I like. There's books that I listed on the top. These are kind of my basic go-to books: Anti-Cancer Living, Cancer Fighting Kitchen. I really like this book, Mindfulness-Based Cancer Recovery by Linda Carlson. Those are my favorite websites. Certainly the Society for Integrative Oncology, it should say, and the MSKCC. I started a podcast with now 2 guest hosts as well. It's called Integrative Oncology Talk. And then I really like this app called Onkyo. Check it out. It's brand new from England. And it gives you tips and education and a lot of personalized information. And then I want to put a plug in if anybody's interested. Our Society for Integrative Oncology conference is in October in Irvine, hosted by the City of Hope. So getting back to the person that I saw, so she basically came and saw us, and she got yoga. She started doing yoga and acupuncture, which basically got rid of her hot flashes and joint pains. Her sleep improved because of exercise. She used ashwagandha. She meditated every day and she reduced her caffeine. And then we helped her with anxiety. She saw a psychologist and she went through cognitive behavioral therapy and had massage. Her bloating went away with smaller meals and she worked with a dietitian. She took a really focused approach on natural products that she was using. And as I mentioned, she started running again and felt much better. So I think my take home point is that we can help create a personalized approach to connect with the person, find out what they need and help support their health. So I'm going to stop there and happy to answer questions.
Hey, Dr. Rao, we have one question in our audience, and that's with Alyssa, and she's a provider in oncology. And she wanted to see if you could talk about the phytoestrogens in food and use in ER-positive breast cancer survivors. I have found conflicting information, and we get this a lot with our registered dietitian team.
It is conflicting. I mean, so this has gone back and forth, historically in terms of what the guidelines are. So there's different ways to look at it. First, from a kind of a population standpoint, the groups of people who eat more soy tend to have less breast cancer. So in terms of causing breast cancer, that's pretty suggestive that it's not. The thought is that the phytoestrogens, they have a weak estrogenic effect, but that they're not as likely to stimulate your cancer cell, for example, or the development of cancer as your estrogen itself. So it might actually prevent more stimulation of estrogen. And the general consensus, there's a great article at Harvard on this, is that moderate soy, which is really probably one serving a day, is safe and probably beneficial. And so, then you talk about what type of soy. We like non-processed, non-GMO, so tofu, edamame, rather than like soy cheese and soy milk and stuff like that. So that's kind of what we tell our patients.
Perfect. Thank you for that. And we've had a lot of interest, Dr. Rao, because we have members from across the country that are interested in finding an integrative oncologist in their area. Do you have any suggestions or resources that our members could go to perhaps be able to connect with a professional?
There's a couple. I mean, so one is University of Arizona, the Integrative Medicine Fellowship. They list integrative providers in the U.S. Now, many of those have been trained there, but they list other people as well. There was a list by another person at FON Therapeutics, FON. I don't know how updated that is. So those are the two places that I would look for. I think that it's fine to ask, and if you don't know, get your doctors to ask. I think that there's usually somebody who knows somebody. And that may not be like the perfect way to go about this, but I do feel like there's a bit of a gap that we should be, kind of have a better list. The part of the problem is that anybody can call themselves an integrative provider. And that's actually part of the issue. So how do you define that? Does somebody have to call themselves integrative oncologists? It could be an acupuncturist. There's people who are primary care or nurse practitioners who you wouldn't know, but they do a lot of the same stuff. It could be functional medicine. So this takes a lot of different forms in different places. And thinking about kind of, you may not in certain parts of the country find somebody who does everything. But it's very different, and it's also what you're looking for. So in certain places, it may be a traditional healer. So I don't want to say it's a one size fits all kind of thing, where you have to find somebody like me. That's great. And yet for somebody else, it might be something they don't want that. They may want something totally different, or they just want a dietitian, or they want a health coach, or there's so many different flavors of this.
Yeah, I love that. And I wanted to call out just a comment that Judy put in the chat, just about palliative care and working with a specialist. That has been one of the best steps that she took. I think that's a really impactful statement that she shared, and hopefully opening up to others that, you know, a palliative care specialist can also be a resource, someone that they can connect with for information about a lot of these services that you mentioned and what we offer at
Right.
Unite for Her.
Well, so there's a lot of movement towards palliative care and integrative medicine working together. So the largest program I can think of is in Houston at MD Anderson, and actually these are all under one umbrella, working together. And you mentioned I was the director of supportive oncology, and that included basically palliative and integrative, trying to make these things, because they're both important, and so you try to figure out what that individual needs. And there are some things that a palliative care specialist, I'm an oncologist, I refer to palliative medicine all the time. So when you get into the details, everybody has their own training and approach. And it's really nice to have a collaborative approach, and different people have different styles that can be beneficial.
Yeah, that's wonderful.
I wanted to echo what Kelly said, because I was thinking about Dr. Maida. He's actually in Philadelphia and we know him well, and he is the Director of Integrative Oncology at MD Anderson Cooper, which is right in Philadelphia. So that is someone, we have a lot of our Philadelphia community sometimes is on here. So just know that that's somebody else. And he's very familiar with our program. So that is where we come in, where we can bridge that gap between that wellness and medical community and pay for those treatments, where we pay for the acupuncture, the yoga, the massage therapy, the unlimited access to registered dietitians. It was really great to hear everything that you talked about, because it is what the Unite for Her program is. And just really honored to be serving in such a way that can help people adhere to treatment. So really, really great to see that alignment.
Mona, I see you have your hand raised, so if you want to come off of chat, you're welcome to do so.
Hi, doctor. Thank you so much for being here. I'm really confused because I am I'm seeing an integrative oncologist at City of Hope, who just recommended a Centrum vitamin for me. I have terrible, debilitating fatigue and also severe brain fog. And I also have Hashimoto's thyroiditis. And he doesn't believe in the Nutra-Eval, which I'd had done. Do you believe in that, the Nutra-Eval?
I do. But this is where, it's such an evolving field. And so, the reason I like, I'm a fan of some of the functional medicine stuff, is because we're so imprecise. And I can't imagine, being a patient, but even as a provider, that's not how we like to practice oncology. So, as a cancer provider, everything is moving towards a really precise way to approach cancer. What is the right treatment for the person? But once treatment's done, or when you have symptoms, or somebody has nutritional issues, we're quite imprecise. And I think that there's this gap, like what kind of vitamin does somebody need? And maybe not everybody believes in vitamins, okay, but I think there's a lot going on that we're not aware of. And that there's a lot of, it's going to be different 5 years from now when we know more. So that's my take on it. So, I like the information. I'm not sure exactly how to use everything. I've done some functional medicine training, but I'm not certified. So that creates a certain problem if you don't know how to deal with the data you're getting. And it's certainly, you could argue that, we don't have, outcomes where we know if it really improved things or not. But, the reality is we don't know sometimes what somebody needs. and they just have symptoms. And so, unless you're going to fix them, and that's where I do feel like clinical experience really helps, because, you may not have a research study to quote, but if you've had 100 patients benefit, that's kind of enough, right? Then you start feeling kind of confident that this can help. So, the reality is that people are going to disagree because there's no true guidance on that. It's a developing field, and these are things that we need to discuss more and debate. It's still a debate, but ideally we get more evidence that such and such helps. So, but I believe in it.
It's just very, disconcerting getting so many conflicting opinions. And another integrative doctor that I consulted with wants to put me on a 21-day purification cleanse, which is like close to $300. And I don't know like who to trust.
It's hard. I don't have a good answer for you, because it's, I don't know what that recommendation is, but it's also, there's a lot of variety in people's approaches, where the conservative approach is to say, look, I'm not going outside of this circle of evidence. And many people in academic centers, that's kind of how we're taught to practice. I'm not going to do anything controversial. I'm just going to focus on what we really know, which is a good place to start, and then you start having other things that we really don't know, and then it becomes more of a patient choice. And yet, many people are asking for these things, or there are people out there who say, no, I actually feel like this really helps. And so there's this gap of, how, opinionated should we be? And that's where you try your best to really look at it, but where there's no information, that's why I talk about risk tolerance. If somebody has a real downside to doing something, then I would say no. If it's somebody who's got a really good prognosis and just wants to improve their health in such and such a way, then you can experiment. I mean, after all, it's a person's individual choice.
Do you know anything about a cellular micronutrient test?
Other than the functional medicine stuff, that's what I think of. But I don't personally employ that stuff myself.
Okay.
That's what I understand.
But even the naturopath that I also consulted with, which she is associated with the university, and she herself said that Centrum is a very low quality vitamin and not absorbed easily. So I'm like, I'm just really floundering, and I have no quality of life.
Yeah, the key thing is to find the right team and have people work together. That's really the bottom line. Where
Right.
it creates problems is if everybody disagrees and you don't get clarity. And that comes from all the different people. In a perfect world, you have people who are used to working together, who know each other, who interact, and have a way of interacting that doesn't confuse patients.
Right. Well, I was hoping that Dr. Lee, who it actually is at City of Hope, would be
Yeah.
the person to help me, but he's the one that recommended Centrum. So now I'm really confused.
I can't go beyond that. He's a good friend of mine, actually.
Okay.
So, Maria, you had a question? You're on mute.
Okay. Hey, Dr. Rao, I would just really like to thank you and unite for her, because I've been reading on integrative medicine for since I've been diagnosed, and this 50 minutes, I've learned so much and I actually understood. And I was just I would also just like to mention today's my first year cancer anniversary for MBC, but since I've been participating in one of Unite for Her's programs, which they pay for, Stronger Through Cancer, which offers free yoga, meditation, cardio, strength training, and also we have gratitude on Fridays. It has really changed, my mental state, and I'm not I was expecting to be broken down today because it's my first year cancer anniversary, but I'm actually doing well, and it does really help.
Congrats.
So that's it.
That's
So
great.
like you said, hopefully eventually the thing is insurance would cover it, but right now they don't, but that's why I thank you to Unite for her. So thanks, Dr. Rao. Hopefully I'll see you in October. I want to attend the integrative thing. Is that open for us
Yeah,
or just?
of course. Yeah, it is.
Okay. Thank you.
You're welcome.
Thank you, Maria.
Alyssa?
Mhm.
Hi, I'm Dr. Rao, and really want to thank you for your presentation, which was so excellent, and thank Sue and Unite for Her for having you and for bringing this together. I just want to, I guess, put a little plug in for the Society for Integrative Oncology, where you're the president, and I'm a patient advocate there, and also a nurse, and also someone with metastatic breast cancer, a participant in Unite for Her. So I feel like I kind of break it down in my mind in that there is no cure for metastatic breast cancer. So, I mean, I think there's a really different approach for integrative in people that are trying to prevent recurrence, like in an earlier stage, and are in the cure, which is fantastic. Um, and the people that are in the metastatic state and where there is no cure. I'm curious how you see it, Dr. Rao.
Yeah, I mean, I was a breast oncologist for about 9 years. And, the reality, the trouble is that when somebody has metastatic cancer, it becomes less predictable. You can't promise somebody that they're going to live 8 years. You can give somebody an idea, but things happen, right? It's just like getting older. It's difficult. And yet we're getting better and better at treating breast cancer. So people are doing better. And so our job is to help with symptoms from their treatment and help people do everything they can to improve their outcomes and their quality of life. And then what I tell people as an oncologist is just how fast the field is moving. And so I try not to look at how long are you going to live? Because, even what you said, there's no cure, that's right now. I mean, I fully expect if it's 10 years or 5 years or somewhere in the future, we're going to be curing all these cancers. I really do think that way. So, I don't think we should think too long term because it's changing very rapidly. So I think we don't want to be stuck in our thinking because we may have a whole different way of treating cancer than we do right now. That's just my hope, actually.
Thank you. We had a couple more questions, if you don't mind, if we go through them.
Yeah, I'm happy to share my presentation, first of all.
Yeah, if you give that to us, we can post that with the recording. So
Sure.
we'll have that recording up and then we'll put the presentation, which we do have. We'll take it without the.
Yeah, I can see some of these chat ones. Do you want to ask me some or?
Yeah, there's one that says, is there a way to protect heart and brain when on an AI medication for breast cancer?
Well, I like mushrooms, so I like lion's mane for cognitive function. I don't see any harm in that. Turmeric is another thing that I'm, kind of, high on. That has some benefit to the brain. Again, in a different setting. In Alzheimer's, there's some evidence, but I don't see any harm in that. I think the heart one is a little bit more complicated. Breast cancer patients have a higher risk of heart disease. We don't understand why. And so the only way to protect your heart is all the other things, eating healthy, high fiber, not gaining weight, and exercise. So that would be what I would do to protect your heart and brain. I mean, there's, it's not like an anastrozole causes a lot of problems to your heart and brain anyways. So.
And I do want to point out, we had a cardio oncologist in an educational segment late last year that talked about this very thing, about risk of heart disease long-term and what we can do. So I highly encourage, again, checking out our library. It was a really wonderful segment.
Yeah, thank you, Erin. There's another question that says they've been told that taking collagen was not good for breast cancer. Is that true? Does it stimulate cancer cells to grow?
I don't think it's shown to stimulate, but I'm going to answer this in a couple ways. One is I don't know off the top of my head, okay? And second, for those kind of questions, I look up the MSKCC About Herbs website. So I'm going to ask that person to look it up because that's what I would do.
Yeah.
Elderberry, I don't have a problem with elderberry. again, if somebody has metastatic cancer, so there's a difference, first of all, how are you taking this stuff? So when I've taken elderberry, it's like this super, super sweet syrup, which I love. That's probably not great if you've got like, active cancer per se. We don't know. I mean, it's supposed to support your immune system. Would I really make a big deal out of this? No. But the other thing is that these highly antioxidant fruits, they're thought to be helpful for prevention, the immune system, etc. But if you have very active cancer, there's some thought that maybe it's not helpful. I would say it's fine. I don't think I've ever told somebody not to use elderberry.
There's a question here about what other alternatives are there for ER-positive breast cancer besides hormonal therapy?
Yeah, I'm glad you asked that question because this comes up a lot. And I think this is where I'm, try to stay on the conventional side, because the reality is if we had an alternative, what that would mean is that we have some kind of data. And, there's just no data, there's no study looking at what if somebody didn't take an anastrozole or a tamoxifen, but they did X, Y, and Z. We don't have that information. What we know is that out of 100,000 women, those who took tamoxifen, had a 5% benefit or a 10% benefit, and same with anastrozole, depending on your risk. And so, it's apples and oranges. And so usually I always tell my patients, it is your choice, first of all. Secondly, we need to give people the information on the numbers, and that's their choice how that hits them. For me, if I can reduce the risk by 5% of a recurrence, that's important to me, but I'm not the one taking it. And then the second thing is some people are miserable and other people aren't. But if you are, do you really want to live like that for 5 years or 7 years of your life? That's also a personal choice. But, those have, negative effects sometimes. So what I always tell people is don't assume it's going to be bad. Take it and see how you feel, because there are very few patients who really die from those medications. You might have a bad month, but it's an important decision. So I always say, look, I prefer you try it before you assume that it's going to cause side effects. We try to help minimize those side effects with integrative approaches, but we don't have an alternative. You're accepting that if you don't take it, that we would expect that there's a slightly higher risk. That doesn't mean that that's going to be you, and that's your choice, but there's no alternative. In an ideal world, we want to do that and maximize all your lifestyle stuff so you have the best outcome.
Thank you. Sally, I'm just going to answer you right out. I see that are there services like yoga and acupuncture here in Lower Delaware. So we do have acupuncture in Delaware. I don't know how far you can travel. If you look at our provider list, you'll be able to see that, and we fully fund that acupuncture for you. And yoga, we're actually doing in virtual now, and it is incredible. I can recommend Allison Donnelly. She does a one-on-one consult. Actually, we have many, but she does a one-on-one consult, just like we're talking to Dr. Rao right now. And it is powerful. So know that a lot of our services have turned virtual so we can get across the nation and making huge impact, very similar to what Maria said about our Stronger Through Cancer program that also offers yoga. So know that you can go there, and on our provider list, right on our website, we have over 200 providers that work across the nation that can help you with that, and of course, fully fund it.
Okay, thank you.
You got it. You got it. Do we have any other questions, Erin, that we missed, or Dr. Rao?
Online yoga. There's a lot of good online yoga stuff. If you look up the Dana-Farber Zakim Center, they have a YouTube channel with like 100 online yoga videos. Another good one is the Utah Cancer Center has one. They have a bunch of YouTube videos. And then Memorial Sloan Kettering has a program called Integrative at Home. It's like a subscription, and you pay $25 a month or something, and they have online classes and things like that.
Wonderful. And I'm just popping the link into our library. We have some yoga videos as well. And I know Priscilla, who does our virtual education program, also has online classes that she teaches live in her library. So no shortage of yoga that is attainable for all of us. I think there's levels for all of us.
Yeah, and we can even do some one-on-one private sessions with you as well.
Yeah.
Donna was asking, I was delighted to see the results of BCI text okayed for me to stop anastrozole at 5-year mark. Breast surgeon is recommending 7 years. I'm conflicted.
I cannot comment. You know, all of that, first of all, you know, you don't want to have too many cooks in the kitchen. And, you know, there's guidelines for all those things, and it really depends on your stage. You know, I have a sense, but even in my role, you know, I try not to go beyond, you know, my role, because, you know, I don't want to undermine the oncologist or the surgeon. But that's where a relationship really helps, and knowing what you know and what you don't. You know, I'm in a pretty unique position because I'm a pretty experienced medical oncologist. But I think there are many people who they just say too much sometimes. Like, you have to know what your training is. And so if you're seeing an acupuncturist, I wouldn't want them to comment on this question, right? I may be able to, but I'm going to be hesitant, and I might on my own email the provider if there's times where I may know better than they do. But that's really important to know, like, okay, what is my role in this team? And where do I defer to somebody else?
Thank you, Dr. Rao. I think that's
Stand
incredibly
up,
important.
Jessica, am I pronouncing that right?
Yes, yeah. Can you hear me?
Yeah, I can't see you, but
Okay. Oh,
it's just I'm seeing your head. Yeah, that's it.
oh, there we go. Sorry, I can't see myself on my view. Hi, doctor. I have a question. So you mentioned a little bit about how fast things are moving, and for me, it's a lot of gathering information for my mom. She's stage 4 ovarian cancer. What do you suggest as far as like keeping up with new therapies or treatments or just information? Because I feel like there's so much that us just her diagnosis has been within the last year. And so I'm just
So there's a lot of ways. I mean, you know, it's a little overwhelming, to be honest with you. I mean, I think it's helpful if you have one cancer that you're following, because even for me, I can't keep up with everything. So, you know, I think a good thing is every year there's ASCO, which is in June. And you don't have to go to ASCO, okay? But afterwards, there's usually like videos on places like YouTube or generally ViewMedi. There's somebody who will, you know, put together a video of all the updates. Then, you know, ASCO Post usually puts some updates. I don't know. I think I'm probably not the right person to ask because, you know, I'm an oncologist, so you know when I think about it's easier for me to update because I'm looking at the medical literature. I don't quite know how patients get updated. I think there's lots of advocacy groups, but I don't know if somebody else probably would know better than me here.
I would say if I could chime in, we have wonderful partners in the ovarian space that do advocacy work, like Dr. Rao mentioned. Sandy Rollman, Okra, Clarity, Share. So all of those that are supporting the, and that's just a short list, but all of those that are supporting the ovarian community also do a wonderful job of sharing information and news in the science world. So I would also connect with advocacy groups and patient support services for the particular type of cancer. And usually you can stay pretty well updated through them as well.
And then this post-chemo neuropathy, I like acupuncture. That's usually where I start. I don't find that supplements are very helpful. You know, certainly there are patients who take medications, but we like to try acupuncture. And if that doesn't work, and usually that works for pain, we don't fix numbness. So usually if somebody has ongoing numbness for months, that acupuncture generally, in my experience, doesn't help. one of the treatments that we're using at university hospitals that we're probably going to do a study on very soon, reflexology is another one, yoga is another one that you can try, is something called scrambler therapy. And that, so far it's been like 80% effective. So some people have like really bad neuropathy and medications don't work, nothing works, and it's a non-invasive treatment that has been very popular. We just started it like 7-8 months ago, and we're planning to do a study. So I usually do a stepwise approach. Certainly there is a role for medication, but those have side effects. And so yoga, stress management, reflexology is great, but acupuncture is kind of where I start.
Okay, well, I know we're past our time. I think we could keep going for sure. You know that we're always available. So please, if you have any more questions, we can be in direct contact with Dr. Rao and get those questions to him as well. Dr. Rao, it was great. Thank you so much for joining us. We appreciate your time. Obviously, you're speaking our language, and it's so nice to see the alignment. And we look forward to more to come,
Thanks so much for having me. I appreciate you guys.
Yeah, you got it.
Bye.
All right. Have a good night.
Take care.
Thank you.
All right, Erin. So I think that was
That was
another,
wonderful.
another great speaker series and so much to offer. And when we hear so much about all the findings and then you see what Unite for Her offers as a full comprehensive program, it just makes us all know that we are on the right path. Where the SIO has the research and the science, and then Unite for Her comes in and actually delivers and funds those treatments. Please take a look at our poster as well at SABCS. I think you'll find a lot of data there. I see Elisa smiling because she knows that data well. It's on our website at uniteforher.org/SABCS. And you'll be able to see the findings that we have when you do start putting integrative care into your everyday living, right? Because we want you to live your life and we want you to feel that you enjoy those moments. So I know that's how Unite for Her all started. It was my experience, and it was where I saw this gap, and I saw that there was such a need to have access to acupuncture, yoga, massage therapy, nutrition. And it all started with 23 women in Paoli Hospital, and now we're over 5,300 across the nation.